Hello, this is Dr. Grande. Today the question is, what's the difference between schizoid personality disorder and schizotypal personality disorder? So it's not unusual that these two personality disorders become confused, probably because the names are a little bit similar. But these are distinct personality disorders. So first let's take a look at schizoid personality disorder. If we look at the symptom criteria for this personality disorder, we see someone who doesn't seem to have an interest in building relationships. They tend to be solitary. Sometimes they're referred to as a loner. They don't appear interested in having sexual relationships with other people. They get decreased pleasure from activities that would normally bring pleasure. They tend to lack close friendships. Now, sometimes they do have a close relationship with first-degree relatives, but that's normally about it. They seem indifferent to praise or criticism, and their affect can sometimes be described as cold, detached, or flat. So there are some similarities there with schizoid personality disorder and the symptom criteria for schizotypal, but as you'll see, they're actually quite different overall. So when you think of schizotypal personality disorder and the symptom criteria, we start with ideas of reference. With ideas of reference, individuals make incorrect interpretations about situations and events. And specifically when looking at external events, tend to think that those events have some special meaning or relationship to them, specifically to the person with the disorder. Also, we have odd beliefs and magical thinking that's tied in with schizotypal personality disorder sometimes. When we think of this criterion, we think of someone who believes in telepathy or extrasensory perception or other types of odd or magical thinking. Now, these beliefs aren't necessarily unusual in and of themselves. A lot of people believe in those things, but it's the extreme divergence from what we typically see that would be characterized in this criterion. Also, unusual perceptions, but it's not the same as psychosis. It's not really a delusion or a psychotic episode, but rather this unusual way of perceiving reality. Next criterion is odd thinking or odd speech. And here with the speech specifically, we think of it as over-elaborate, metaphorical, or vague. And sometimes words are used in an unusual way, but the speech is not incoherent. An individual who meets this criterion and has schizotypal personality disorder would still be coherent. So the next criterion is suspiciousness or paranoid ideation. So somebody with schizotypal personality disorder oftentimes is suspicious of other people. And this ties in a bit with the social anxiety piece I'll talk about in a moment. Another symptom criterion is inappropriate and constricted affect. So again, consider this in terms of schizotypal and schizoid being different. The criterion for schizoid was cold, detached, or flat. So similar, but not the same thing with the symptom criterion. The next symptom criterion is behavioral appearance that is odd, peculiar, or eccentric. Again, this is highly consistent with the odd thinking and the magical thinking criterion from before. An individual with schizotypal personality disorder typically lacks close friends, again with the exception of a first-degree relative. This is the only symptom criterion that exactly matches a symptom criterion from schizoid personality disorder. And then we have an increase in social anxiety. So I mentioned earlier this ties in with the paranoid symptom criterion. So typically when we think of people that are exposed to social interactions, even if they don't want to be there or it's not a pleasant experience, usually exposure leads to a decrease in anxiety. With schizotypal personality disorder, because the paranoia and the social anxiety are oftentimes combined, when somebody's exposed to a social gathering or other social event, they become increasingly agitated and increasingly uncomfortable in that environment, rather than getting used to it, which is what we would expect to see. And we believe it's that suspiciousness of other people combined with that high social anxiety. So, can somebody have schizoid personality disorder and schizotypal personality disorder at the same time? Yes. Actually, that's not unusual. These two disorders are highly comorbid with one another. Another question I get a lot with these two personality disorders is, do they indicate that somebody's going to develop schizophrenia? We don't really see that too much with schizoid personality disorder, and we don't see it a lot with schizotypal either, although we would think that somebody with schizotypal personality disorder would be more likely to develop schizophrenia. The percentage risk for both are fairly low. These are personality disorders, so we think of them as chronic, long-lasting, and stable. They're tied in with personality structure. So there is a risk of schizophrenia developing with these two disorders that would be higher than if the disorders weren't present. And we do see some other evidence that there's ties to schizophrenia. For example, individuals with schizoid personality disorder and schizotypal personality disorder are more likely to have first-degree relatives with schizophrenia. However, it's rare that we see somebody with these personality disorders develop schizophrenia. So schizoid personality disorder and schizotypal personality disorder are distinct personality disorders, and really if you look at the different criteria, specifically the symptom criteria, it would seem the odd thinking and odd beliefs, unusual appearance, unusual perceptions, and ideas of reference are probably good criteria in order to distinguish these two disorders. Now again, in both of these disorders we see a lack of close friends and we see an unusual affect. So there is a similarity there, but overall it should be relatively straightforward to tell these two apart. I hope you found this description of the differences between schizoid personality disorder and schizotypal personality disorder to be interesting. Thanks for watching.